The Global Vaccine Alliance, otherwise called Gavi, has provided much funding for primary healthcare service in Nigeria. Gavi's plan to stop the funding of vaccines next year has raised serious concern about how the government of Nigeria will make up for the funding gap that the exit of Gavi and other donor partners will create.
Ladies and gentlemen, all invited guests.
This forum is organized to discuss financing for the nation's primary healthcare sector. The acting executive director of the National Primary Healthcare Development Agency states the effects of poor funding for the health sector on primary healthcare services.
Over time, resources being allocated to healthcare in general has been dwindling, with Nigeria never attaining the Abuja Declaration, which was to allocate 15% of the annual budget to health. The result has been a steady decline of funds to the primary healthcare subsector, which has suffered the most as a result of the dwindling fortunes.
Also, a representative of the northern traditional rulers at the forum explains how the lack of funding for primary health care has affected their communities.
You look at the primary health care hotspots in these villages, some of them are not functioning. And the areas that they are functioning, manpower are not there.
However, the representative of the Minister of Health, who confirms the underfunding of the health sector, assures of government determination to increase funding going forward.
The administration of His Excellency President Muhammadu Buhari, GCFR, would want to be remembered for its role in making basic healthcare services qualitative, accessible, and affordable to all Nigerians. It's our hope that it would inform an increased allocation to the sector.
Out of the over 6 trillion naira federal government's budget for 2016, 221.7 billion naira was earmarked for the health sector. Experts say this is a far cry from the 15% of the nation's budget agreed by African leaders at the Abuja Declaration in 2001 to be committed to the health sector.